Well, hello everybody, and today we're talking about what is probably the most important thing we all need to think about every day in our careers as part of the health tech sector, and that is patient safety. So we're going to be hearing about the work of ABHI's Patient Safety Group and also a really exciting project they're embarking on at the moment, which hopefully one or two more people will be interested in. To do that, I'm delighted to be joined by two of those very hard-working people in our ABHI group structure, the chair and vice chair of the Patient Safety Group. I'll allow them to introduce themselves first. Steph, would you like to start?
Hi, so my name is Stefanie Russell. I'm the Vice Chair of the Patient and Workforce Safety Group at ABHI, and I work as the Clinical Affairs Manager at Stryker. So thank you very much for your time today.
Great, thanks, Steph. Greg.
Thanks, Richard. And I'm Greg Quinn. I work at BD, and I'm the chair of the Patient Safety Group, and delighted to be partnering with Steph and many other members, which I hope we'll talk to you about in a moment.
Great. Well, thanks, Greg. I mean, this patient safety, I said, is so important. It's one of those things that fits absolutely everywhere, but not always necessarily somewhere on its own. So tell us a little bit about the work of the group and how you've gone about it and setting out your priorities.
We're a really great, diverse group. We have the big hitters, the big companies, but we have fabulous resource and support from some of the SMEs, some of which are very small organisations. We have the benefit in England of having a very established patient safety strategy. We have a director of patient safety at NHS England. But it's a topic that everybody agrees with, but nobody ever really knows what it literally could be. So we spend a lot of time discussing as a group, not just what the golden threads are and the importance for ultimately patient outcomes and value for the NHS, but we also talk about what it really could look like. What's the tactics? How can we do patient safety? And having that breadth of membership enables a really good content for us to talk about that. And we reflected that in our first report a couple of years or so ago, where we gave 6 practical examples of what it really looks like. And we were delighted to get some really good traction, particularly when we launched that at the Patient Safety Congress. So we knew we were on the right strand, but of course, these things don't stand still. So one challenge that Steph and I enjoy and endure is keeping the agenda alive and keeping it moving.
Right, that's great. And you always welcome other people who want to join in and support your work.
100%. One of the most, I think, powerful things about patient safety is that huge overlap with so many other areas. I often talk in my day job at BD about how important not just safety is, but also efficiency and sustainability. And it's no secret that the safest service out there is also the one that gives the most value, and it gives the most value to everybody, all stakeholders. So we welcome perspectives from everybody in that community. And from an external basis, some of the most meaningful and useful conversations we have are absolutely with non-clinicians, people across the whole, route of delivering services to people, from logistics and supply through to implementation and delivery, through to training and monitoring, and then crucially to publishing that monitoring and actually discussing why things are good or maybe they're not so good, irrespective where that benchmark is. How do we make it a bit better? And making it a bit better as far as possible in a no blame culture. And I think where patient safety has really moved agenda forward, and that's been acknowledged by the appointment of the Patient Safety Commissioner and other key roles, and the investment absolutely that NHS England has made, is that if you're all working on the same side within that no blame culture, you can actually really push forward without people worrying about being tarnished or targeted, and you can keep the patient really clearly at the front of your mind and make a difference and continue to make a difference. It's not something that we ever do. I used to work in audit, and so I'm very used to tick boxes. You can't tick the box of patient safety. You have to go on the journey.
Great, thanks, Greg. Yes, and people will have heard of the Patient Safety Commissioner, Henrietta Hughes. I know your group has done a great job at being the real focal point for ABHI's contact, and I know you have regular updates with her office. Steph, before we get into the detail of the work we wanted to talk about, anything you want to add about the work of the group?
I think that, and Greg will probably agree with this, that during this time that we've been chair and vice chair, that actually truly understanding the size and scale of something as broad as patient and healthcare worker safety is no mean feat, and that the medtech industry has solutions that can help patients across most of the healthcare areas, and understanding how we can apply them and where we could be most pivotal is really important for impact. So I think our group is focused now on understanding what good looks like in healthcare safety, so we can keep this issue really at the top of the agenda.
Right, thanks, Steph. So, Steph, tell us a little bit about, there's an intriguing piece of work you're involved in at the moment with an organisation called Patient Safety Learning. Maybe tell us a little bit more about that and some of the opportunities that might exist to get involved in that.
Absolutely. So we've been really lucky to work with Patient Safety Learning over the last year or so. And we've been speaking with Helen Hughes, who really is a huge specialist in patient safety and healthcare worker safety. And so we've approached Helen and said, look, we'd like to do something where we look at patient and healthcare safety, but also where the medtech industry can show that they've got best practice of where we've done things really, really well, and how we can align with things such as safety management system approach that's at the moment, partnering with others such as policymakers, providers, researchers, so that we can produce a really meaningful white paper that sets out how we want to move forward in this area. It's been a huge amount of change over the last, I'd say, 2 years, would you say, Greg?
Absolutely.
Yeah, huge amount of change. And so there's lots to still learn. And I think we're going on, as Greg said, it is a journey, and we're going on that journey at the moment.
Great, thanks. Greg, anything to add to this particular piece of work and how people might get involved?
I think Steph summed it up really well. I mean, we're in a post-COVID environment now, so there is another tier. I think industry and healthcare have stepped up in the fact that there's the level of trust and also a real understanding of the breadth of innovation that can be offered. And the project will certainly, I think, focus on some uptake of that innovation. It's not about selling widgets. It's about improving outcomes. And it's about everybody working together to enable the end commissioner or purchaser or deliverer or carer to make the best decision for the person, but also for the public purse. And that's something which we've had great discussion in our group about. And certainly we've been recognised with those external conversations that we've had that we can offer some really good strategic counsel. That's quite a highfalutin term, but we're recognised as experts in this area, which is humbling, a little bit frightening, but also very exciting. And I think this piece of work certainly will build on that and enable the group to really acquire a position in the environment where we are seen as central to that change and a great resource for everybody.
Well, that's great. Thanks both for detailing that. What we'll do, this goes out attached to this. Also, your opportunity to get in touch with the group through Judith for people who may want to support the work. Just leaves me to say thank you both so much for all your hard work and energy that's gone into this group. It's been a challenging group, as we've discussed, in that it's so broad and we could take it in any number of directions. But I think it's gone on leaps and bounds. So that's down to your leadership and your energy. Our groups are the beating heart of the organisation, a place where I think people realise the best value. So thank you for everything you do for us. And we look forward to an update on this in the months ahead. Thank you both.
Thank you so much.
Richard. And I'll just add, Steph and I have a really easy job because we have fabulous people in the group supporting us. So there are more fabulous people out there. So please make some contact with Judith and ourselves, and we'll grow together.
Great. Thanks, Greg.
Thank you.